Hey everyone, it's your girl Emma from EA Public Relations. Welcome to Free Falling in Niagara. Today we're going to talk about racism in the healthcare system. I'm going to show a clip of a doctor who is the department head for critical care in Canada. His name is Dr. Kojo Carmenteng, and he is actually from Ghana, which is my home country. And he's going to share the racism that he experienced as a student and as well once in the actual workforce as a doctor. It's quite disturbing. Let's roll the clip and then we'll talk about it.
This was a real unfortunate situation where we were learning about vitamin D and the importance of sunlight, and the professor essentially made it sound that people from African descent were inferior based on some of these impacts. And what a hard spot to be in when you know that professor has a direct impact on your future, and at the same time you want to represent your people and stick up for what's right. And yeah, that was one of my earlier unfortunate episodes where
you spoke up.
Yeah, you had to speak up.
What a tough position that would have been. You know, you're in medical school, you want to do well, you want to get through, and then your professor says something like this, and you sort of have to decide. Do you stick up for yourself or do you stay quiet so that you can get through medical school without any issues? I applaud him for being courageous and sticking up for himself.
You know, everyone's got a different disposition, but you know, my parents raised me in the way that you stick up for yourself. A few weeks ago, one of the nurses presented me as head of the department or chief of the department, and the patient looks at the nurse and starts shaking their head and saying, this can't be, he must be chief of some African tribe. And it was just, yeah, like it, and this is, you know, I'm in a situation where I'm there for the patient. I'm there to try and get them through this tough time, and to be treated like that. And, you know, I've been in a room when they've asked for the real doctor. I've been called the N-word by patients. Like, it's, you know, it's hard to talk about, but it's an important issue that unfortunately is still present despite it being 2023.
We heard from Dr. K, and he shared what he's gone through as a student at the hands of even his professor, and the racial comments that were made. He also talked about in the workforce, you know, with patients calling him the N-word, patients saying they want another doctor, patients saying he can't possibly be a department head. And then we are also dealing with the other issues with the data in the health industry that's really not supporting Black people and people of African descent. He also mentioned blood pressure medicine and the fact that the blood pressure meds that are out there, they don't work for people of African descent and for Black people. I happen to know that for a fact because both my parents suffer from high blood pressure. They're from West Africa, Ghana, and we've tried many different medications, and they just don't seem to be working for them. Sometimes they have to take a combination of two. So it would be great if they would do what they're supposed to do and do the needful and make sure that the data that they're bringing out represents all nationalities, because we also deserve the right healthcare too. So as people say in Canada, healthcare is free. However, are we really getting the proper healthcare? He also talked about COVID and him being accused of wanting to make more money and see more patients. We also know that COVID was disproportionately affecting the Black and Brown community more so than other counterparts. So again, this speaks to the information and the data and the research that's required so that we can also be treated accurately, given the right medicines, so we can also recover from any illnesses that we have, or any illnesses that we suffer from are taken care of and managed. Thanks so much for tuning in. As usual, I look forward to your comments. Let's talk about this. You can catch me on my YouTube channel, EA Public Relations. Otherwise than that, you can get me on Instagram, Emma, EMMAA_Ansah, ANSAH. I look forward to seeing you and speaking with you. Until then, peace be.